All right, it looks like our folks joining us has slowed down a little bit. So John, if you're ready, I think we can go ahead and get started.
Well, wonderful. Welcome. I'm John Parvinsky. I'm the President and Chief Executive Officer of the Colorado Coalition for the Homeless and the President of the Renaissance Housing Development Corporation. And on behalf of our board and staff, I want to welcome you to this exciting virtual groundbreaking of the Renaissance Legacy Lofts in the Stout Street Recuperative Care Center. This is our first virtual groundbreaking. I guess one of the benefits of doing a virtual groundbreaking in the winter is it's about 40 degrees outside, a little breezy and snow, and so we get to avoid that. The screen behind me is a site of the construction site just this morning. And so you can see we cheated a little bit. We could not wait till today to gather to actually start construction, but we are truly underway. And what we'll do today is give an overview of the project. We have some speakers, both live and via video, that will add to the context of the development. But again, we really appreciate you being here with us this afternoon. We're going to start with a quick slide presentation that kind of gives an overview of the project. I have to share my screen now. I'm sorry, I lost my technical capacity there for a moment. So
we can see your screen now, John. If you
okay, great. So the
just need to pull up the PowerPoint onto the screen that you have. Looks like you're sharing. There you go. Got it.
Okay. So we're looking at the rendering that we'll see a little bit later. This is the beautiful building that is under construction now, that will be the site and the home ultimately of 98 individuals of permanent supportive housing and 75 units of recuperative care that will provide housing, short-term housing and recovery housing for up to 500 individuals a year as they enter, or they are released from the hospital and are getting the recuperative care and support they need in transitioning back into the community. You can see the site at 22nd and California, just behind the Stout Street Health Center. And so taking advantage of the great integrated health services that are provided by a tremendous staff there at the health center. So this project was actually 4 years in the making. It was 4 years ago that we had, well, the dream goes back much longer than that. Over a decade ago, we talked about the need for respite care, recuperative care, for the many people experiencing homelessness who were stuck in the hospitals, couldn't be safely discharged to the streets. 4 years ago, we started the process of actually putting together this development, and it's taken to this point to actually get the financing in place, to get the construction drawings to place, to get the contractor in place, and to actually begin construction. The project is probably the most complex that I've ever been involved with, and many of our partners have said the same thing. And it started with creating the Legacy Plan Community Association to actually develop the site, to create 3 ownership units with 3 separate sets of financing in order to leverage both tax credits and investments and other types of funding that was limited to particular uses or particular entities. So those three components includes that 75-bed recuperative care center with 50 beds being dedicated for folks coming out of the hospital for 30 to 45 days while they're in need of ongoing medical care, but not needing hospital level, more expensive care. Then 64 units of permanent supportive housing that is financed through traditional low-income housing tax credit, competitive financing, and then 34 units of additional supportive housing financed through private activity bonds and the 4% tax credits that come along with that. So how many partners does it take to create a catalytic development like this? And it seems like a setup for a joke, but it isn't. But I just wanted to give it a hint of what it took to bring it together. So it took that one planned community association to create that common interest community with in accordance with Colorado law. 3 limited partnerships, one special limited partner to bring to bear the benefits of that. 4 separate investors who have put their funding in return for the tax benefits and tax credits associated with each component. 4 different lenders that are providing both construction lending and ongoing lending for the project. 8 legal teams. You can imagine what a joy it's been to work with 8 sets of lawyers, each with their own interpretation of what the law requires and how to get a project like this done. So it's amazing that we ended up getting it all done virtually. 2 Section 8 providers, the Housing Authority and the Division of Housing, that makes the affordability so critical. 4 governmental agencies providing grants and funding for the project. 2 separate community development entities pursuant to the new market tax credit structure. 8 separate foundations providing capital grants. 500 individual donors providing funding to fund the construction of the recuperative care piece. A cellular architect that was able to develop the design and bring together the consultants and engineers to make that happen. A well-respected general contractor who has promised to get this project done on schedule and on budget, so who could ask for anything more than that. 5 major subcontractors and 1 creative developer. So actually what it takes is a village to put a project like this together, and that village has really come together. So the recuperative care financing strategy centered around the new market tax credit structure. And for those of you who are familiar with that, know that it's a fairly complicated structure, but we were fortunate to have the Corporation of Supportive Housing allocate $10 million of new market credits for this project. And Chafa's subsidiary provided $7 million of new market credits for this project. The Northern Trust Company provided the equity investment on the new market side to make it happen. The foundations provided more than $10 million of funding to leverage the new market credits and to be able to develop the funding for the development. We had those individuals who provided the capital support to both fund the construction, but also in an initial operating reserve. We had the funding for the City and County of Denver through the Department of Host, as well as the Department of Local Affairs providing funding for each component of the project. So this was a critical piece to be able to get that done. Initially, we're only going to do the recuperative care center that would have been a 3-story structure. And we decided, since the zoning allowed us to go much higher than that, we were able to then pull together supportive housing financing to be able to build 4 levels of LIHTC, 9% supportive housing, and an additional 2 levels of private activity bond, 4% tax credit funded to make it a 9-story building. So we had, again, those competitive tax credits, the private activity bonds, enterprise housing community investment provided, the syndication, bringing the Northern Trust Company in as the LIHTC investor as well. The Denver Housing Authority, through the D3 bond program, provided the land acquisition and are providing the Section 8 subsidies for a number of the units. The Colorado Division of Housing providing housing vouchers as well, in addition to gap funding for the private activity bond component, as well as the Recuperative Care Center. And the City and County of Denver Department of Hosts providing gap funding for all 3 components. And then our friends at the Federal Home Loan Bank of Topeka providing an affordable housing program grant as well. So again, you can see a lot of financing going into the housing side, all of which needed to be separated. I won't go through the full list. I've mentioned a number of the folks who are true partners in here. But First Bank is our construction lender on the affordable housing side, the supportive housing side, and have been a tremendous supporter. Our friends on the foundation community, the Anschutz Foundation, the Colorado Health Foundation, the Wagon Annalee Shore Foundation, Wells Fargo Foundation, Colorado Access, Darrell Brown, the Fidelity Foundation, Jay and Rose Phillips Foundation, and of course the Northern Trust that helped during the pre-development phase of this as well. Again, the financing so critical to do a $46 million project. I'm not going to go through this, but this is just for those not familiar with new market tax credit structures. This is what we had to get our board to understand so that they knew what we were getting into, and it's all working according to plan. Our development partners, again, critical to making a development like this work. Christopher Carvel Architects, Millender White as a general contractor, SB Friedman, our new market tax consultant. And then the folks at the Colorado Coalition for the Homeless and the Renaissance Housing Development Corporation staff, Jennifer Cloud and Bill Windsor heading up the team, Joan Reardon, our legal counsel, Jay Hans and Max Lebarsky and Kaylee Hill, Amy Moore, who heads up our property management team, providing great insight, and then Lisa Thompson, our chief operating officer, ensuring that the project would be, once it was built, would be operated and managed in a way that added value to the community. So this is an aerial view of the site. You can see, again, right next to the Mercury Cafe, and we've been working with Marilyn McGinnity at the cafe to minimize the negative impact on that, that institution of the neighborhood and the city, to make sure that there was compatible uses. Again, we're building this right behind the Stout Street Health Center and the Stout Street Lofts to make sure that we can build upon the infrastructure and the quality services that are there. This is the site as it looked before the construction fence went up. Again, this is the site this morning in the snow, all ready to build the foundations and start going from the ground up. Again, the renderings and the quality architecture that Chris Carvel has been able to put together, we think will provide a facility and a building that will enhance the neighborhood, that will add not only needed housing with the supportive services, that recuperative care that is so critical, but will be an amenity that will be look like the new market rate housing that has just been built in that neighborhood. The recuperative care beds will be more hospital-like, providing, again, a space for folks to recover, but also to be observed with our on-site nursing staff and medical and pharmacy staff to be able to meet the needs of those as they're recovering, as well as connecting them to longer-term housing options. This is the exciting piece that has been missing in our continuum for so long. And then on the upper floors, this is a representative view of one of the one-bedroom apartments that will be home to one of the 98 individuals. And we're working with many partners in terms of connecting with our partners at Denver Health, looking at how do we target this as a resource for folks who are high utilizers of healthcare to again leverage the services at the Stout Street Health Care Center from a primary care perspective and connect them to long-term housing and stability that is so critical. So with that, I will give up my stop sharing, and we have then some speakers that are going to add their context.
John, do you want to share the rendering video?
Oh, was I going to do that now? Okay, we'll do that. So just share it again. So can you, okay. So this is a rendering an animation that was put together by Melinda White. And so again, you can see the construction
Sorry,
site.
John, we can't see it. I'll play mine if you wouldn't mind, and then you can talk through it.
Okay, so this is the rendering or the an animation of the construction process that Melinda White has put together, and it shows the timeline of the site preparation, the work in terms of putting in the aggregate piers, building the foundation. As a 9-story building, requires a fairly sophisticated tower crane. The building of the elevator shafts and the emergency staircases, using 4 levels of podium construction for the recuperative care, and then using an infinity light gauge steel system to be able to build up the 6 stories of the residential supportive housing component. And so this is what we'll be seeing throughout the summer. As the exterior skin is put on, the building is dried in. The windows are put in, and the interior work, of course, the HVAC systems, the electrical, the plumbing, everything after the structure is in place. And by the end of the year, we'll see a building that is pretty much near completion from the outside. And during the spring or this time next year into the spring, most of the work will be on the interiors, building out the spaces, the individual apartments, the recuperative care center, with a goal of finishing by May of next year. So we think it'll be exciting to see that go up. We've worked with the Mercury Cafe to protect their solar arrays by moving them, and to be able to ensure that and then we'll also be putting solar panels on our roof to make sure that we can add to an energy efficient environment and help save the planet. So Meredith, remind me who's next.
I'm going to share Mayor Hancock's, and then if you'd like to finish your presentation after that. Okay.
Hi, I'm Mayor Michael Hancock. Denver desperately needs this housing and recuperative care site, and this project comes at a critical time. The connection between housing and health has become clearer with COVID-19, and this project is a perfect example of the integrated approach that is needed. You know, we are happy to have a long-standing partnership with the Coalition for over 35 years now. Projects like this and our work together on Denver Measure 2B, which passed just this last fall to increase much-needed resources to people experiencing homelessness in our city, are so necessary. And we are grateful for our continued relationship for projects just like this. We celebrate this project and look forward to its completion next year. But let us be perfectly clear. There's still more work to be done to decrease homelessness in Denver. Thank you.
So thank you, Mayor Hancock. We appreciate those comments. And it's my pleasure to introduce Britta Fisher, who's the Executive Director of the Chief Housing Officer for the Department of Housing Stability, a great partner, former colleague. It's great to have Britta in that post, and I'll turn it over to Britta.
Thanks, John, and thanks for having me here today. And what a huge day it is for Denver and for people experiencing homelessness in Denver with this supportive housing project and recuperative care center. Given the COVID landscape that we've had for nearly a year now, the city has been working incredibly close in partnership with the Coalition over the past year, nearly daily, frankly. And we've had a lot to do together and with others. That includes standing up extra shelter space, having non-congregate shelters, the hotels, where we have protected some of our most vulnerable to the virus and safely isolated others who are medically directed. We've stood up the extra shelter spaces where the Coalition has done medical screening of guests and helped to provide access to primary mental and behavioral health care. That's so important, especially in a pandemic. And we've ramped up COVID testing, rehousing strategies, street outreach, and now vaccine. On top of all of these Herculean efforts, I'm pleased to say that great development projects still continued during these trying times. And the Legacy Lofts is a great example of that. The solution to homelessness is housing. And today is a major cause for celebration with the kickoff of Legacy Lofts. As we move forward, we are pleased to continue playing a role in bringing this project forward and through needed gap financing, grant funds, and supportive services dollars. This innovative project provides not just 98 homes for those most in need, but also something that we could desperately use more of and was apparent in this pandemic. And that's a safe place for people to recuperate and recover from illness and medical conditions. It takes a strong community partnership to move affordable housing forward. John just gave a great lesson and really helped to showcase what it really takes across many partners to create affordable housing. And over the past years, the city has been in partnership with the Coalition. We have together helped to fund 1,100 housing units. That's a tremendous legacy. So I thank the many partners who are involved in this project, the Denver Housing Authority for supporting the site acquisition with our D3 or Denver Housing Authority Delivers for Denver program, and leveraging the property tax mill levy revenue from our Affordable Housing Fund, and for providing voucher support, an important component. We also thank the State Division of Housing, CHAFA, but most of all, I want to give my hearty congratulations to John Parvinsky and the Coalition for the Homeless. This is a great example, a legacy of lasting solutions to homelessness here in Denver, and we're so pleased to partner today. Congratulations, John.
Thanks, Britta. Really appreciate those words and really appreciate the partnership that we've had with the city, not only on these construction projects, but in the planning to address not only the current emergency of COVID, but the ongoing crisis of homelessness that we're seeing in our community. The Denver Social Impact Bond that has proven to be so effective for those that we've been able to house. And I think showing that if we can do more of that, it will not only make a difference on the lives of our most vulnerable neighbors, but also truly change the landscape of what we're seeing on the streets today. So we appreciate your leadership in terms of the role that you are playing with the city of Denver, and we look forward to ongoing support and ongoing partnership to meet the strategic plan that you and the city council and the mayor have put together. So thanks again. Next, our partner in almost every development that we have done has also been the Department of Local Affairs through the Department of through the Division of Housing. And I'm pleased to introduce Rick Garcia, former city council member, former HUD official, and now leading the charge at the state. So Rick, it's great to see you.
Great, thanks, John, and good to see you as well. And good afternoon to everyone that's on this virtual groundbreaking event call. John, congratulations on the Renaissance Legacy Lofts and the Stout Street Recuperative Care opening. Lots of room for congratulations today, but beyond the work that you're doing today, let me also acknowledge the work that the Colorado Coalition for the Homeless has done since 1984. Has been the state's leading advocate for affordable housing and healthcare for Colorado's most vulnerable populations. And we're happy to say that the Division of Housing and DOLA have been with you with many of these projects, that you have provided housing for over 3,300 households and healthcare to over 13,000 individuals around our state. John, your work has been exemplary. To you and your team, I congratulate you. I particularly want to congratulate you on what I consider to be one of our state's, if not nation's, most innovative projects. This recuperative care and Stout Street program is innovative. You already alluded to the many sources of commitment and funding, capital that are required to bring these projects together. I salute you and your team for your ongoing dedication and fortitude in keeping this vision alive. We need this kind of recuperative care or respite care to keep individuals housed as they are discharged from medical care and hospital or clinic care. They don't have a place to go and to call home. Most of us take that for granted when we are sick and leave hospital care. So this is a very innovative project, and I want to certainly call the attention to that. The Division of Housing, as you indicated, provided housing solution program support in the form of a $2 million loan for the recuperative care facility, and also a grant and a little over $1 million to couple the 4% private activity bond, the residential component that you already alluded to, as well as housing choice vouchers. And as you said, again, it takes the city, federal agencies, CHAFA, of course, to bring all the needs together to make these projects happen. So I want to congratulate you. I also want to give particular acknowledgement to the Division of Housing team led by the energetic Allison George for all of the work they've put into making this project come to reality. So we look forward to seeing this project come to fruition and helping you with many other projects around the state. Congratulations again, and also on behalf of Governor Polis. Thanks, John.
Thanks, Rick. Again, we really do appreciate the team that you mentioned, the governor's support, and Allison's and her team just doing a remarkable job during a challenging period of time. Also, just trying to make sure that the funding that's available to address the COVID needs of homeless people is being well spent. And so takes a yeoman's work just to do that, let alone to support projects like that. So we really appreciate that work, and we appreciate the ongoing commitment and support of the Department of Local Affairs and the Division of Housing. Congresswoman Diana DeGette was scheduled to be with us today, but had a last-minute conflict, and so we have representing her Joe Middleton, who will read some remarks from the Congresswoman.
Thank you, and good afternoon, and thank you for inviting the Office of Congresswoman Diana DeGette to participate in today's wonderful event. My name is Joe Middleton, Congresswoman DeGette's District Director. Unfortunately, due to votes taking place right now, she is unable to be with you as she originally planned, so she asked me to read the following statement on her behalf. Dear friends, I am honored to share in your joy today as we celebrate the happy occasion of this groundbreaking. First, I want to thank Coalition President and CEO John Parvinsky for his persistent leadership on the issue of homelessness, and also wish to thank their VP of Communication and Public Policy, Kathy Alderman, for maintaining a close relationship with our office for many years. And beyond John and Kathy, special thanks to all those that had a role in making today possible. The village that John referred to at the top of his remarks, the village that includes some speakers today, and certainly many more that are in the audience. It's a pleasure to work hand in hand with all of you on this issue that we care so deeply about. Denverites know the fundamental importance of having quality, affordable housing in our community. We know that the number of people experiencing homelessness has only increased in Colorado during the pandemic. Many people were in a financial bind before COVID-19 struck, and as the pandemic continues to unfold, for some, this situation has only worsened. That's why I, along with my colleagues, have passed vital legislation to provide economic support, including housing protections for those impacted by the pandemic. And we look forward to working with the Biden administration to develop a comprehensive strategy for the housing challenges that we face. It is clear that communities like ours need additional housing resources for people experiencing homelessness, and that we need to support our lowest income earners to prevent further homelessness. To that end, today is an occasion for celebration because we are taking a significant step forward in the fight to reduce and prevent homelessness. The legacy loss will provide the additional housing we so desperately need, while utilizing the coalition's holistic approach to housing stability. And the recuperative care facility is especially unique as it will provide a safe space for people experiencing homelessness to heal from medical issues rather than be released to the streets or to shelters. Rest assured that Congress is ready to support these efforts in passing a package that prioritizes housing relief. In an effort to stem any further homelessness, Congress is looking to provide $19 billion in funding for emergency rental and utility assistance. Additionally, Congress is looking to provide $5 billion in emergency housing choice vouchers to help transition people experiencing or at risk of homelessness to stable housing. We know there is more to do on these urgent issues, and I am committed to continuing to work with stakeholders at all levels, federal, state, and local, in order to accomplish meaningful housing reforms. Congratulations again, and thank you very much for extending this kind invitation.
Thank you, Joanna, on behalf of, we really thank Congresswoman DeGette. We were just talking before she was at the groundbreaking of the Stout Street Health Center that occurred 9 years ago. She was also with us 11 years ago when we were with Speaker Nancy Pelosi and then Representative Jared Polis doing a press conference supporting the Affordable Care Act that was then being considered by Congress. So the passage of that act and the ability to make that happen, to get funding to be able to build a health center and to continue to do this work and to ensure that all Coloradans have the right to either Medicaid or other alternative health insurance through the Affordable Care Act is so critical. So we appreciate the Congresswoman in making that happen. So next we have Representative Candy Sidibaka to provide some taped remarks representing the district that's the Stout Street facility is located in.
Hello, my name is Candy Sidibaka. I'm your District 9 City Councilwoman. I wanted to make sure to congratulate the whole team at Colorado Coalition for the Homeless for your tireless work to make the dream of Legacy Lofts Recuperative Care a reality. We're lucky to have this project join the Stout Street Health Center in our tireless efforts to serve the most vulnerable neighbors amongst us. It is not enough to provide affordable housing. We need options that include the services that come with supportive housing, and we need places for our unhoused neighbors who are recovering from medical conditions, especially now during this pandemic. My family's been in this community for 5 generations. The problem of poverty and inequality has been ever present in this historically redlined neighborhood. The changes in our city and community have not and will not erase the root causes of homelessness. Building new market rate and luxury units in place of public housing will not end poverty. It will and has pushed the impoverished deeper into poverty, and it has pushed us farther from solving the root causes. I personally have worked directly with neighbors who have lost limbs to frostbite from living in tents, and they were discharged right back to the freezing conditions that put them in the hospital in the first place. I've worked directly with individuals with severe health conditions that require electricity, running water, flushing toilets, all of those things that we take for granted in order for them to recover, and there was nothing in place for them. We have unfortunately witnessed the loss of life in the absence of safe places for sick humans to recover. In a city that has waged war against those least able to fight back, this step is one small step in the right direction, and we have our partners at the coalition to thank for navigating the most unfortunate of circumstances to bring this vision to reality. While this is truly a one-of-a-kind package of supports, I deeply hope that it is quickly replicated throughout the city to meet the vast need in this time of both the health and housing crisis. 2020 has shown us nothing more than it has shown us that we must love and support one another. In doing so, in the great words of Assata Shakur, we have nothing to lose but our chains. We appreciate you and cannot wait for the members of our community who will be served to feel this love in action. Thank you so much from the bottom of my heart.
Great. Thank you so much, Councilwoman. We really appreciate your efforts on behalf of the district and on behalf of the city. I'm, for one, am always heartened by the fact that when an elected official not only sees the lack of affordable housing and the lack of housing for people experiencing homelessness as an act of charity or a charitable need, but really as an act of justice. We know that people experiencing homelessness are disproportionately people of color. They're marginalized. They're more often addressing mental health and addiction issues, more often LGBTQ, and there are just a lot of factors that they're working against. And so as we have this village coming together to address the housing and healthcare needs, we need that political leadership at all levels to ensure that we're addressing the root causes that are feeding homelessness, as well as creating the lasting solutions for the pathway out. So with that, I'm pleased to turn over to the former councilman for this district, who we've worked closely with on many housing developments, who is now working with the general contractor, Melinda White, Elvis Brooks. Elvis?
Yeah, thank you so much, John. Melinda White is honored to be chosen by CCH as a general contractor on this transformative project. As builders, we understand that the built environment is not the complete story. It's really about the people who make up the community. Our vision is to build inclusive communities where all have the opportunity to work, live, and prosper. And we're humbled to make this a reality to our most vulnerable neighbors who are struggling, not only in our city, but nationwide. And so I just want to, we've been giving you a lot of shout outs, John, and you deserve them, you and your entire team. We were talking before when I was city council person, I believe we did 3 groundbreakings in Northeast Denver. And this is the 4th. That means that over 500 individuals who were experiencing homelessness now have a safe place to rest and have those services around them. And I want folks to know, because we've been doing this work nationally, that CCH is a national model of what's going on. And we're so grateful to have you all in the community. I also want to give a special thanks to the city of Denver, the CPD department and permitting. We got on this job, we were awarded this job in November. And as many of you all know, John is always up to good trouble. And he said, we need that permit before the end of the year. And so we worked with the city to make sure that we get the permit. We really want to give a shout out to Scott Prisco, the head building chief, and then the chief of the fire department to really help us get through the life safety issues and receive that permit before the end of the year to make sure that we receive the funding. So thank you all. I also want to highlight the men and women who are actually on the job site right now, and they are already at work making sure that we meet that deadline of allowing this place to be open for our most vulnerable residents by May of 2022. Leading our project is our construction executive and vice president, Matt Jones. He is an incredible leader, and he will be from conception to completion all the way around this project. We have our senior project manager, Adam Dietz. Our project superintendent is Chris Nutt. We have our project engineer, which is Andrew Johnson. Brandon Rockwood is our field engineer. We also have Justin Moody as our field engineer. And Dana Boyle, last but not least, is our project administrator. And we're just so excited for those folks, and they're on the line right now, and they get a chance to hear the impact that we get to be a part of in this city. I want to, you've heard a lot from folks today, and I just want to end kind of talking about this. And I think that slide that John had was so powerful, because this project is an example of the significance of collaboration at a time when people are more divided than ever and working in their silos. We see that actually coming up with solutions is the most important thing. And we need to turn towards each other, putting our differences aside to get to work. And so thank you, John, and the entire team for showing us what it means to build collaborative partnerships. We have seen the private sector, public sector, nonprofits come together with this extraordinary development. And Millender White is humbled to be at the table to make it a reality. Thank you so much, John.
Great. Well, thank you, Elvis. We really appreciate your support over the years. We are glad that you're with Millender White now, and we're glad to partner with them in the construction of this critical project. Just want to finish off with just a couple of final slides, just to give, again, more context as to why we are doing this. So we've talked a lot about medical recuperative care and respite care, and most times when we talk about homelessness, we talk about shelter, and we talk about permanent supportive housing, we talk about affordable housing. But what we're seeing is that there are more and more people who are on the streets who have acute medical conditions that end up in the hospital. And if they had a home, they would be discharged to their home after their acute condition is treated. But many people are not cannot be safely discharged to the street if they have no home. They can't be safely discharged to the shelter. This may be people who have frostbite, people who need daily wound care, folks who have oxygen, which cannot be safely stored in a shelter. There may be people who need daily medication monitoring to ensure that they're recovering. And we want to make sure that they don't boomerang back into the hospital at great cost, not only to that system, but to our overall healthcare system. And so the connection between working with our hospital partners at Denver Health, at St. Joe's, at University Health Science Center, and at Centura and at Health One, we know that these are critical pieces to be able not only to, again, ensure that these individuals don't end up dying again on the streets or have basically needing to go back into the emergency room and back into the hospital because they have no safe place to be. We know from national studies that respite care produces healthcare savings. And at a time when we are seeing great pressure on our healthcare budgets, we know that respite care can reduce the amount of time in hospital for folks who have been discharged by 23%, decrease emergency room visits by 33%, and reduce the need for nursing home care by 42%. This is in addition to the overall improvement of health status for those individuals that we serve. We know that in addition to that, that supportive housing itself can bend the cost curve. Our partnership with Denver Health has shown us that the top 100 utilizers of healthcare within the Denver Health system, the majority, almost 95% of those are homeless. They account for almost $50 million a year of care, of cost to the system, much of which could be avoided if people had a safe place, a safe of their own to call home. And so again, national studies have shown that supportive housing itself can reduce inpatient encounters in the hospitals, as well as the costs associated with those. So supportive housing clearly saves lives. We just need more of it, and we need to work with our hospital partners, our friends at the Healthcare Policy and Finance at the state level, to ensure that we can bend the cost curve, not only for the benefit of taxpayers, but if we can ensure that those individuals do not need to be re-hospitalized, that will be a great improvement in their lives and will make a difference forever. So I'll end there saying that we'll look forward to seeing you for the grand opening of this facility in June of 2022. And with that, if you have any questions, I think we'll open up the mics. And if folks have any questions to ask, we'll be glad to answer them if we can.
I'm not seeing any questions in the chat or the Q&A section, but if folks have some questions or remarks they'd like to make, feel free to do so in the chat or in the Q&A, or just make sure you're following us for additional information after this event.
Okay, well, not hearing no questions, I guess we covered it all. Again, thank you all for your support, your partnership, your participation in this effort. As was mentioned earlier, the sad thing is even after this project is complete, that there will still be thousands of people on the streets of Denver, in the shelters in Denver, in the Metro Denver area, and throughout our state. And we need to, again, redouble our efforts to address that through that combination of housing, healthcare, addressing mental health, addressing addictions. The support that's provided through the Stout Street Health Center, through integrated health of not only primary care through wonderful doctors and nurses and nurse practitioners, but also psychiatrists and behavioral health providers, social workers, nurses, medical assistants going out, doing outreach on the street with outreach workers, having that as a benchmark within our city to be able to intervene does make a difference, and does make a difference in the lives of the thousands of people that we're housing tonight who would otherwise be homeless and adding to the street landscape. So we know what works. You all know what works. We just need to do more of it. This is a great down payment, and we look forward to continuing to build the capacity throughout our community to do more of this and to save lives, save money, create a better quality of life for all of our neighborhoods, for our businesses, and most of all, to provide housing and healthcare justice for our most vulnerable citizens in our community. So thank you again, and we'll look forward to seeing you soon.